Fort Erie residents and advocates are calling on Niagara Health to restore around-the-clock urgent care services in Fort Erie and Port Colborne. Niagara Health cut down the hours of operation in July because of staffing shortages. Manisa Danabalan tells us more.
Fort Erie residents and advocates gave MPP Wayne Gates a petition today. For the past few months, they've been collecting signatures, and now it has more than 4,000, which will be presented in the legislature next week.
Many times in the winter, we can't get out onto the highway because of the snow belt that we're in. And I dare say without even our urgent care at that particular point in time, there really is life and death.
You either go to Niagara Falls or you go to maybe Welland, but the emergent surgeries aren't working. You can go to the urgent care there.
But getting there is a challenge for some who can't drive. Demonstrators today said almost half of the population in Fort Erie doesn't have a family doctor as an alternative, leaving limited options for many seniors, especially in the winter when storms can shut down transportation.
How many remember the storm last year where we couldn't even drive down the highway for 5 days? We couldn't get out of our homes. And yet they want to shut this hospital down from 10 or 8 o'clock at night till 8 in the morning for 12 hours. It's absolutely wrong.
Earlier this year, Niagara Health announced urgent care centers in Port Colborne and Fort Erie would permanently shorten their hours to close overnight in order to redeploy staff across the region. In a statement today, Niagara Health said it continues to struggle with a shortage of health human resources, including emergency-trained physicians. Going on to say at this time, we have no plans to revisit the hours at our UCCs. But for residents and advocates, the fight isn't over. Manisa Danabalan, CHCH News.